Hey friend, welcome to Grounded, the vestibular podcast. I'm Dr. Madison Oak, aka the Vertigo Doctor. I am the vestibular physical therapist who is here to help you with all things dizziness, imbalance, and vertigo. In this podcast, we explore the fascinating world of vestibular disorders. Come with me as we dive headfirst into a journey to discover the mysteries of the brain, the inner ear, and the balance mechanisms that keep us grounded. Whether you've been managing dizziness for one day or 25 years, we're going to get real about what it takes to manage dizziness, handle the anxiety cycle, and thrive, not just survive, with your vestibular disorder. First, I want to remind you that this is never medical advice. Remember, this podcast is for informational purposes only and may not be the best fit for you and your personal situation. It shall not be construed as medical advice. The information and education provided here is not intended or implied to supplement or replace professional medical treatment, advice, and or diagnosis. Always check with your own physician, medical professionals, and healthcare team before trying or implementing any information found here. Hello and welcome back to Grounded. Today I wanted to talk to you about the things that I would do if you were dealing with neck pain and vestibular migraine or any other vestibular disorder. The first thing we want to know is differentiating neck pain from neck pain for a reason and then for the purposes of vestibular migraine. Vestibular migraine itself can be the cause of neck pain without anything being actually wrong with the neck. Hopefully that makes sense. So again, neck pain can come from migraine itself. It can be a prodrome symptom. If you don't know what that means, that means you should go listen to the episodes about vestibular migraine, but that's basically like the first phase of migraine. It can also be during the attack phase, interictal. It can just be because you have migraine. So first, learn that. Second thing, what do you do with neck pain? There are three main things that we want to consider, and these are the three things we address in the 6-week neck protocol and Vestibular Group Fit as well. So in Vestibular Group Fit, we have a 6-week neck protocol. That's 6 weeks of specific exercises that you would do every day if you have neck pain, starting with a chin tuck and then moving on to things like eyes, Ys, and Ts and overhead movements and things like that. So you can get back to kind of just doing normal motions, and there are ways that you can kind of progress it more quickly or more slowly depending on you and your particular needs. So all that to say, it's important, again, to understand where it is that it's coming from. That's number one. Next thing that I would want you to consider is going to be posture. Can you hold this like nice upright posture and move within that posture? If the answer is yes, that's awesome. If the answer is maybe not so awesome. So again, you want to be able to hold this upright posture, ears over shoulders, shoulders over hips, hips over knees, knees over ankles, and you should be able to hold that for an extended period of time. That being said, posture is never, and I mean never, about standing up perfectly straight all the time. Posture is, in fact, instead about being able to move your body consistently throughout the day. So can I hold myself in an upright posture? Yes, but it brings me to number 2. This is going to be a pretty quick episode. To movement. Do I allow my body to move, or am I stuck in a slouched position all day? Or am I stuck in an upright position all day? Some people are like, well, I have this horrible neck pain. I'm going to try to just have really good posture all the time. And that means that you're not allowing the neck to move. Now, this can come from dizziness, and we'll talk about movement in relationship to dizziness as well. But something to understand is that if you are a person who has a vestibular disorder, it might be more difficult for you to move, right? Especially move your head, which is something that is really frustrating for most people. But again, posture. Posture is important, being able to hold that posture, that upright posture. Then being able to, on top of that, move your body. So sometimes I slouch to my other side. I sit up straight, I stand up straight, I shift to one side, I shift to the other side. I allow my body to move all day. I try not to sit in one position for more than 45 minutes, But honestly, I probably don't sit in one position for more than 15 or 20 because even if I'm seeing a patient for 45 minutes where I'm not getting up and moving, I am shifting kind of left and shifting right and moving back and sitting back in my chair and forward on my desk and typing. So I try my very, very best not to stay stagnant for more than honestly 15 or 20 minutes. And that in itself will help your bones, your muscles, your joints just feel better. Now, from a dizziness perspective, you can kind of start to move like a robot, and we want to avoid moving like a robot as much as humanly possible because humans are humans and humans are not robots. And so you do not want to move like a robot because if you move like a robot, that's going to cause a lot of tension through your neck. And I see a lot of patients with this, whether or not they know it, and we have to have a long conversation about allowing your neck to move. And they will tell me, well, I'm scared to let my neck move because if I let my neck move, then then I will get dizzier. I won't feel still. I won't feel comfortable. So start slowly, a little bit left, a little bit right, a little up, a little down. And if you can't look up, down, side to side, it's time for you to join Vestibular Group Fit because we have videos on how to do all of this. But generally, you should be able to move your head around it. If you see something in your peripheral vision and you want to turn your head to go look at that thing, you should be able to do that. That's part of being a human being. So again, it will also make your neck less stiff because you're allowing that motion, you're allowing your neck to relax, and then you are moving forward. Last but not least is going to be strength. Not only strength of your neck, which is important, specifically your deep cervical flexors rather than your big movers of your neck, but also what's important is understanding your strength of your upper back and mid back, which are the supportive places of your neck. So your upper and mid back support your neck and are also movers of, well, some of it is our neck movers, but scapula and shoulder movers, which also need to be taken care of. So again, differentiating between your deep cervical neck flexors and your sternocleidomastoids and your trap muscles. I think most of us know where our SCMs are. If you don't, no big deal. It goes from right behind your ear to the middle of your not the middle of your collarbone, the inside piece of your collarbone. Most people, you can see them on, they're a pretty big neck muscle. They're a big mover of your neck, and that is normal. That's important to know. Same thing with your traps. They are back here. A lot of people say, I think almost everyone says that I have the tightest traps of anyone, which if you're all saying it, it's not true, right? But most people do have pretty tight traps, and that's okay. It's because a lot of us carry a lot of stress in our traps. Our shoulders are up by our ears, even though they shouldn't be, mindfully putting them down, things like that. But strengthening those muscles is great. However, most of them are already over strong and over tight, whereas our little supportive muscles, like our deep cervical neck flexors, such as our longest colli and longest capitis, are the ones that need to be strengthened a lot of times. These are our teeny tiny endurance muscles that do like 5 to 10 degrees of motion, really not a lot. They really just do this tuck kind of a situation. And they're really, really important. You can barely feel them moving. A lot of people say, well, I don't know why I'm doing this. I can't even feel anything. And that's okay. We want to be used to using those, but relaxing the rest of our neck. Then on top of that strength, you are then able to use your bigger shoulder muscles, your bigger back muscles, your bigger neck muscles to do what they're supposed to do because now your deep cervical muscles are stabilizing. So to recap, we have posture that's important. We have motion that's important, and we have strength that's important. These three things together can absolutely change the state of your neck, especially if you have vestibular migraine, especially if you haven't been moving your neck for a long time, if you have cervicogenic dizziness, if you have triple PD. All of these things are important no matter what kind of dizziness you are dealing with, post-concussive dizziness, whatever, it doesn't matter. You need to always look at the neck as well. The neck is not causing your vestibular migraine. Vestibular migraine is kind of a chicken and the egg with the neck, but it's not the cause. Remember, the cause of migraine is a genetic predisposition to migraine. If you have any questions about this, please feel free to send me a DM. I love you, and I'll see you next time.